Welcome to Radiology in a Minute. I'm Sid Dogra, Deputy Editor of Radiology in Training. I'll be discussing a new paper just published in Radiology, Zero-Shot Thoracic Oncologic History Generation for Radiologists using Retrieval Augmented Large Language Model Pipeline by Johnny et al. As you all know, radiologists rely heavily on clinical history when interpreting images, but this is often time-consuming to gather, especially in oncologic patients, where we have to synthesize information from progress notes, operative notes, pathology reports, lab values, and so on. Many studies have looked at the ability of large language models to collect this information for us, but these studies often aren't realistic for real-world workflows. For example, some of them require the relevant types of notes to be provided as an input in order for it to be synthesized. The authors wanted to explore a technique called retrieval augmented generation for this task to automatically retrieve relevant clinical info and generate structured oncologic summaries. They used retrospective EHR data from 50 thoracic oncology patients. 20 radiologists helped select 10 clinical parameters for summarization, including oncologic diagnosis, TNM staging, presence of metastases, prior therapy, current therapy, clinical trial status, and key findings on prior imaging. For each patient, the pipeline retrieved relevant clinical notes, path reports, imaging reports, surgical notes, and radiation treatment logs. Three LLMs were tested: GPT-4o Mini, O3 Mini, and GPT-5 Mini. Authors evaluated accuracy against the retrieved clinical text and also evaluated completeness, where they used an adjudicated GPT-5 Mini derived reference standard rather than a fully independent human-created ground truth. GPT-5 Mini achieved the highest completeness at about 95% and the highest accuracy, nearly 98%. O3 Mini had similar accuracy but lower completeness and longer processing times. GPT-4o Mini was the fastest, generating these summaries in about 13 seconds compared with 240 seconds for manual chart review, but completeness was only around 62%. So the key result is a trade-off. The fastest and cheapest model was less complete, while the most complete model was much slower. In summary, this zero-shot RAG pipeline was able to generate accurate, structured oncologic histories without manual fine-tuning or information retrieval. The work is promising for radiology workflows, but implementation needs to account for model-specific trade-offs in speed, cost, and completeness. Thank you for watching Radiology in a Minute.